In this video, we're going to talk about central lines or indications for central line placement. So I'm going to write here, central line indications. The way that I like to think about our indications for a central line, I categorize them, I put them in two big buckets. The first bucket is interventions, and then the second bucket is measurements. So when we think of placing a central line, it's either for a specific intervention or it's because we want to measure something, we want to gather data points that tell us the status of our patient. So the first intervention is if you want to give vasoactive drugs or vasopressors. So it's been thought, or the long-standing, I'm going to put a 1 right over here. The long-standing thought has been if you give vasopressors through a peripheral IV, you could cause, there's a high chance of tissue infiltration, ischemia, and necrosis to the vein, the small vein, peripheral vein that you're using. So placing them in central venous, in central veins will mitigate that. So the typical recommendation is to administer these vasopressors through central veins. However, it has been shown that you can technically still give these medications through a peripheral IV, and it won't really cause, it's thought that there won't be as much tissue necrosis or ischemia or infiltration as previously thought. However, for the purposes of this video, this administering vasopressors and the current recommendation is if you are thinking of administering vasopressors, it's better to do that through a central line. The second indication in our intervention category is total parenteral nutrition, so TPN. So the TPN solution is hyperosmolar to the blood, so there's a greater chance that phlebitis can occur if you give it through a peripheral line. That's why we give this through a central line. The third indication for a central line is a temporary, if you're placing a temporary pacemaker and temporary transvenous pacemaker. So in some conditions like sick sinus syndrome or procedures like TAVRs, you will place a central line in order to temporarily pace the heart. The fourth indication for a central line is if you have, or your patient has an air embolus, which we will talk about in another video. This is an emergency, and one of the interventions that you can do is you can place a central line and aspirate the air out of there in order to stabilize the patient. And then the fifth and last intervention that we use a central line for is if you have no peripheral IV access. So if you have a patient who is a very difficult IV, and everybody has tried to poke them multiple times, at that point it's better to place a central line, or it's indicated to place a central line if you can't get good peripheral IV access. Now, there are two measurements that are indications for a central line. The first one is if you want to monitor the central venous pressure. And that'll give you a good clue as to the fluid status and the volume status of your patient. The second one is if you want to identify your central venous oxygen saturation. And basically what your central venous oxygen saturation is, it's an assessment of oxygen delivery to tissues. If it's high, then that means you're not really delivering oxygen to tissues. If it's low, then that means that you are consuming a lot of oxygen. Your tissues are consuming a lot of oxygen. The normal value for this is 65 to 80%. So in summary, central line indications, I break them off between interventions and measurements. Our interventions involve if you're administering vasopressors, if you're giving TPN, if you need to pace the patient temporarily, if you need to remove an air embolus, and if there is no other IV access that you can get. Our measurements involve if you want to monitor CVP or if you want to monitor your central venous oxygen saturation.